Appropriate selection of the device is important for patient safety. To choose the appropriate implant size, examine pre-procedure angiograms and refer to the DFU sizing chart. Choose a Surpass Evolve Flow Diverter system with a labeled length that is at least 10 millimeters longer than the aneurysm neck to maintain a minimum of 5 millimeters on either side of the neck, and allow for the proximal and distal ends of the implant to land in a straight section of the vessel. Using conventional catheterization technique, place an Excelsior XT27 standard straight microcatheter tip at least 20 millimeters past the distal edge of the aneurysm. Remove the guide wire from the microcatheter. Remove the packaging hoop from the pouch and pull the proximal end of the introducer sheath from the white clip on the packaging hoop. Be sure to hold the introducer sheath and delivery wire together when removing the system from the packaging hoop to avoid premature deployment. Partially insert the distal tip of the introducer sheath into the microcatheter RHV and tighten the RHV. Using appropriate pressurized sterile flush or a syringe, confirm that fluid exits the proximal end of the introducer sheath prior to advancing the Surpass Evolve Flow Diverter into the microcatheter. Loosen the RHV, advance the introducer sheath into the RHV, and visually confirm the tip of the sheath is seated deeply in the hub of the microcatheter. Tighten the RHV firmly to secure the introducer sheath to the hub of the microcatheter. Advance the delivery wire to transfer the Surpass Evolve Flow Diverter system from the introducer sheath into the microcatheter. Continue to advance the system until the distal edge of the fluorosaver marker enters the proximal end of the introducer sheath. Loosen the RHV on the microcatheter and remove the introducer sheath, holding the delivery wire in place. If desired, place a torque device on the proximal end of the delivery wire to facilitate advancement through the microcatheter and deployment. Slowly advance the delivery wire until the distal edge of the fluorosaver marker reaches the microcatheter RHV. Under fluoroscopic visualization, continue to advance the system through the microcatheter until the distal radiopaque marker on the delivery wire is at least 5 millimeters beyond the neck of the aneurysm. Confirm the position of the Surpass Evolve Flow Diverter system by visualizing the radiopaque implant. Ensure the distal end of the implant is at least 5 millimeters beyond the neck of the aneurysm. Pulling back on the microcatheter to make final adjustments will ensure that slack has been removed from the system prior to deployment. The Surpass Evolve Flow Diverter is now ready to be deployed. Begin deployment by retracting the microcatheter while putting slight forward pressure on the delivery wire until the system begins to exit the microcatheter and starts opposing the vessel wall. A combination of forward pressure or pushing on the delivery wire and/or unsheathing of the Surpass Evolve Flow Diverter by pulling should enable you to keep the distal end of the implant aligned at the desired landing zone, as well as achieve vessel wall apposition. Wall apposition may be improved by gently advancing both the delivery wire and the microcatheter as a system. If positioning is not satisfactory, the Surpass Evolve Flow Diverter can be recaptured and repositioned. To recapture the implant, simultaneously advance the microcatheter while gently pulling back on the delivery wire. The Surpass Evolve Flow Diverter can be recaptured if the distal marker on the microcatheter has not passed the resheath marker on the delivery wire. After the distal end of the Surpass Evolve Flow Diverter has successfully expanded and begun opposing the vessel walls, deploy the remainder of the implant by alternately pushing the delivery wire and retracting the microcatheter. After the entire Surpass Evolve Flow Diverter has deployed, confirm full expansion under fluoroscopy. Advance the microcatheter over the delivery wire through the deployed implant until the radiopaque marker on the microcatheter tip is distal to the deployed implant. Retract the delivery wire into the microcatheter. Verify that the device has remained patent and properly positioned. After completing the procedure, withdraw the delivery wire and microcatheter.